All right. Thanks everyone for logging on. Before I start, you're all muted, so that's on purpose. The chat's open whole time, so feel free to use it. This is being recorded and everyone registered gets the replay, so you don't need to take notes necessarily. I'm going to take about 30 minutes or so, and I want you to leave with pretty much one idea. Everyone on this webinar has probably heard the words deep plane, likely from an ad or TikTok or because you follow me. And most of the explanations floating around are kind of confusing. They say a regular facelift pulls the skin and a deep plane goes deeper. Sure, but that's not really the whole story. So by the end of this, you'll be hopefully able to explain it better than most of the people doing it. So let's get into it. Quick roadmap so you know where we're headed. I do have to spend a few minutes on anatomy up front. It's kind of the only homework that there is in this whole talk, and once the layers are clear, everything kind of makes more sense. Techniques, I'm going to talk about the deep plane and the traditional smash facelift. Talk a little bit about healing and a little bit about who's a candidate. So when a question hits you, put it in the chat and I'll get to it at the end. So first things first, anatomy. This is the face the way surgeons actually see it, or maybe more anatomists. It's Sebastian Codafana's newest book. And the important thing on this slide isn't really the names, it's the idea that these layers can be separated. His book actually does a great job of this, but you can see first and foremost skin. If you peel back skin, you see a layer of fat, which is like the cushion of the face. The third thing is the SMAS, which I'll get way more into in a second. And then the last thing is kind of the areolar plane, the loose fibrous tissue plane, which is what the deep plane is. So surgery usually travels between these planes. Every facelift you've really ever heard of, every branded lift with a trademark after it is defined by really one decision. Which of these spaces does the surgeon work in? So below all that is the deep structure of the face, the important things that keep you alive and the things that we hope to never see. The major difference between a traditional facelift and a deep plane facelift is the plane of work, namely the relation to the SMAS, which is why this is so important and why everyone talks about it. What is the SMAS? It has a long name. I'm going to say it once and never again. It's a superficial musculoaponeurotic system. Long word name that just means a combination of fibrous things with muscles in a mostly continuous sheet from the neck all the way up through the cheek. And that's why doing a face and ignoring the neck makes kind of little sense. They kind of age together. So second, it's attached to the skin above by thousands of fibrous connections. Continuous sheet has muscles and fibrous things attached to the skin above. I'll get to why that's important in just a bit. But when the SMAS moves, your skin moves, and that's how you make expressions. So just to go back for a second, every facelift that anyone's ever really named moves the SMAS. You'll hear people dismiss a traditional facelift as just a SMAS lift, as if it only tightens the skin, but that's not true because of those connections. So every legitimate facelift performed anywhere is a SMAS one. Skin only lifts went away probably decades ago, hundreds of years ago, because they failed. So when you're comparing these techniques, the question is never really which layer gets worked on. It's always this mass. It's if the layer gets lifted before it gets moved. So that single question is really the rest of this talk. Let me first reference ruggables. You probably all know them. They're those rugs that are washable and they Velcro to the underlying surface. That's the best analogy that I can think of for a facelift. So this is a ruggable, and they have these wrinkles in them that are sometimes hard to get out. So what's the best way to remove these wrinkles? I firsthand have experience with this because Brittany buys a lot of ruggables. And if you have these wrinkles, you find you have to unvelcro them to get them out. You can't just pull it, you can't just iron it, you can't just vacuum it. So you actually have to physically remove from the Velcro, flatten or pull, and resecure. That's what a deep plane facelift does. So you don't really want to just cut out the folds, and you can't just sew them and overlap them without it looking terrible. But why does that matter? So backing up for a second to the traditional SMAS facelift, that's what's done in a traditional facelift. The skin is raised first off of the SMAS. So all those little fibrous connections that are connected, the SMAS to the skin are taken off. Then SMAS is tight. It's either cut or it's sewn or it's plicated, stitched. That is what gives you the lift. Then the skin is redraped and whatever extra skin there is cut off. Now, I want to be fair because I actually trained on this procedure, this mass facelift, and it was the workhorses of the specialty for probably 50 years. In the right face, it gives a genuinely good result. These three moves, They lift off the skin, tighten the sheet underneath, and then the skin lays back and trimmed. The thing I want you to notice isn't what gets worked on, though. It's what's still attached. So the ligaments anchoring that sheet or rug of the SMAS to the deeper structures, the Velcro, was never touched. It was never unvelcroed. So when you tighten it, it's still pulling against the anchors that are holding on to the original placement or what gravity's done. So here's another example. Skin, subcutaneous tissue, dissection plane, SMAS. The SMAS is still attached via that gliding plane to the deep tissue and bone underneath. There's thousands of connections between the skin and the SMAS, though, are divided. So that's why in the older facelifts or in SMAS facelifts, you tend to have a skin that looks like it's a stretched appearance, and you tend to have less of the communication between the deep muscles and the skin surface. The muscles deep are no longer attached to the skin surface the way they used to be. So, what are we doing? This is an example of that SMAS facelift. You can see the sheet of SMAS there. And then in a SMAS facelift, we usually remove a piece of the SMAS because how else can you tighten it? And then you remove it with scissors. In this case, it's a little L shape or a backward 7. That's a SMAS that's been removed. And then you pull it up, plicate it, and you're essentially pulling the SMAS without releasing that Velcro. You then stitch it. That's what it looks like. And it gives a little bit of lift. In the right hands, it's a decent operation, but the skin gets redraped and now the skin is not connected to this mass. So nothing is keeping the skin in position except for tension. And tension is the enemy of a good incision. So here's an example of what happens when you have skin tension. Side note, these are not my patients. They're all easily findable online though. So it looks like that first one is probably a mini facelift. And the incision doesn't look like it goes around the ear, but there's tension on it. The second one looks like a full incision, but there's tension at the base of the earlobe. And then the last one, I can't really tell what kind of incision that is. It's not a standard incision, but all three of these are not the best result. So why is that? It's because the tension is sitting in the wrong layer. Skin is a terrible load-bearing structure. It's elastic on purpose. So if you ask it to help hold a repositioned face and the weight that contains that, it does two things reliably. It shows the pull, and then over a couple of months or years, it stretches and scars poorly. So a facelift fails when it pulls the skin. It succeeds when it repositions what's underneath. Everything on the next few slides is just that sentence kind of repeated or slowed down. So this is the fix. Remove the Velcro or remove the rug from the Velcro and then tighten the Velcro. So same target, different door. We go underneath the rug into that gliding space and we release the ligaments that anchor the sheet or the rug to the Velcro. Once that's done, the whole face moves freely and the skin is still connected to this mass. So every one of those little tiny connections, the thousands of connections on the muscle to the skin, keep your normal movement intact. It's one composite piece, repositioned like a whole unit. Uh, People sometimes ask, well, why didn't we do this earlier, or why isn't it more prevalent or more common? It's because in that same layer are a lot of critical nerves, structures that move your face, and so people were afraid. It's an area that you have to be cautious, you have to know what you're doing, and you have to be able to visualize what you're doing. So, same plane we kind of talked about already. Skin, subcutaneous SMAS. Between SMAS and gliding planes where the deep plane facelift lives. Here's what it looks like once you lift off the SMAS, just for reference. There's normally this gliding plane, this kind of shiny, thin layer that sits on top of this, but these are all those deeper structures you don't really want to see. So when I said there's multiple structures living in this layer, this is what I'm talking about. On the bottom, that orange thing is the parotid gland, and then all the yellow things are those nerves that move the face, and that's what you want to avoid. Obviously, there's vessels and other things too, but those are not just less critical, but they're less in the way. So when you look in the mirror in a consultation, almost every patient I see points to the same three places. They have a cheek that's a little flat, they have a fold by their mouth, and then they have a fold by the corner of their nose, and they don't like any of them. So the release of the SMAS from the deep plane is what allows that whole area to be lifted and this area to be flattened or restored. So the release is what lets the cheek travel. And the neck comes along because it's part of the same rug. So this whole talk can be distilled down to the one word release. When you do surgery, you have to release what you want to move so it moves more freely. It's a very simple complex concept that gets complicated by terminology and anatomy. A fixed rug is tethered to Velcro that's been holding it down, and a released rug has been freed to move, and it can be smoothed. So I'm going to show you kind of how scars look when it's done appropriately. These are both my patients that how their ear looked before and how the scar looks after surgery. In the first patient, he actually had his earlobe reduced, so that's why it's smaller. But the position and the folds actually you can see in front of the ear look almost exactly the same. Same with the second patient. She did not want her earlobe reduced, so it had some weight from an earring, and that same ear shape is preserved because there's no tension pulling that scar forward or down. All right, here's a comparison. The traditional versus deep plane. Still, SMAS is what's worked on, but the only difference is whether it's separated or kept. Sorry, kept bonded or if it's separated. So the mid-face effect here is a lot more pronounced or substantial in a deep plane facelift. The way the layer heals, it sticks back down to where you move it, and it heals in that new position. To talk a little bit about some nuances within deep plane, because there's more and more terms, whether they're copyrighted or just repeated, coming out right now. The preservation deep plane facelift has become kind of a popular term that we've seen in our practice, and it is a real thing, so I want to talk about it. Essentially, preservation deep plane means you get to the deep plane in the kind of most efficient fashion where you don't have to raise multiple layers to get there. So here's what that looks like. On the left-hand side, the deep plane is that pink thing. And that kind of triangle sailboat shape is how we usually get into that plane. This is the standard deep plane approach. Everything that's green is the skin that's elevated first because you have to get to the deep plane first. In the modification or the preservation deep plane, we just get to that pink area faster. So you have less of skin undermining or green area before you get into the deep plane. The reason you can't get into the deep plane immediately when you first enter your skin incision is because where we're trying to hide skin incisions, the deep plane is not safe to enter there. It's right where the nerves come out. So we travel under the skin for about 2 centimeters, and then we dive deep to the deep plane where it's safe to get to. In that second photo, you can see the modification or the preservation approach where there's less green because there's less skin undermining. It's kind of a technical thing, and it doesn't really matter for most patients, but for most surgeons, this is a really educational slide. This is courtesy of Dominic Bray, who wrote this up in 2023. This is actually how that looks in real life. In that first picture, it's a traditional deep plane. You can see how much skin is undermined because the plane that you see is after we've released the rug from the Velcro, pulled the rug, sewn it back down, and then the skin on top is what you're seeing. So traditional, there's a fair amount of skin that's elevated. In the preservation, almost all that skin that's elevated is being cut off anyways. So there's very little space between the skin and the SMAS. So getting to some results here, I just want to quickly talk about what things are possible with this deep plane approach. Um, Expression can stay intact because the skin and the muscle are now still connected. You have minimal skin undermining. The vector of pull can be tailored to the individual face based on how you've aged. People always age with gravity, and gravity always wins, but that vector of gravity pull is oftentimes different for different people. And then lastly, the skin is not the workout horse. The skin is not keeping the load of the weight of the pull. So patients say the word natural to me more often than the word younger, actually. And I take it seriously because it's real mechanical basis. It's not just feelings or vibes. When you smile, your muscle moves the sheet and the sheet moves the skin, and it's through those connections. So if we divide them, we are dividing our ability to emote, to animate, to express, and to be human. So, uh, Dr. Chance in Virginia describes her goal of a face looking healthy and appropriate without announcing that anything was done. And I'd say that's my definition of natural too. Here's recovery. So, I usually tell most patients that they don't want to be seen for about 6 weeks. At 6 weeks, they're like, oh, this looks good. I want to be seen in public. So those first 6 weeks is a very mentally taxing thing. Everyone heals different. Sometimes you're bruised, sometimes you're swollen. And when you look in the mirror, you don't necessarily recognize yourself, especially in that first week. Mike Nyack does a great job of posting these early results, and you kind of see patients' reactions when they're early on in healing. Even when they know what to expect, it can be a mentally taxing recovery. So, week one, swelling and bruising is the most prominent. Week two and three, numbness by the incision and just in front of it still persists. Week six, socially presentable, or you want your friends to see how you look. And then somewhere between 3 and 12 months before that last 10% of swelling really goes away. For scars, they really mature over the course of 2 years. We routinely laser them afterwards to get them to get to that endpoint faster. So, a lot of you have heard of the ponytail facelift or the endoscopic facelift as well. I wanted to just do a quick slide on that because I did visit Dr. KO and see his technique with the ponytail facelift. So I am incorporating that into my own practice. It's a specific type of endoscopic facelift, meaning the incision is not in front of the ear, it's hidden in the hairline, so it's not a visible incision, and that really is its main benefit. It's a little bit better for younger patients or patients that don't have extra skin because you're not physically cutting the skin out. And so if you elevate and you don't cut skin out, you tend to get skin bunching in certain areas. And if the bunching is too much, it's not a good surgery or decision for you. So it elevates the brow, cheek, jowls of the face with no visible incisions. Um, you can do a different type of ponytail lift, which extends an incision behind the ear, still not visible, and does work on the neck as well. But the strict face lift part doesn't address the neck, and it doesn't remove skin. So a face with extra skin, not a great candidate. So that operation itself has a little bit longer dissection time because you're doing everything under a scope, meaning you're looking at a camera on a field to try to do your dissection, and it's done in smaller kind of incremental portions than you would an open facelift. Other than that, it's the same dissection plane, the deep plane. And for the right patient, it's a less extensive operation because the incisions are shorter and the recovery can be a little bit easier. This, by the way, is another picture from portion of what we would do in a neck lift. It's deep to the SMAS, or in this case, the SMAS is the platysma muscle. You can see the nerves and the veins running there too. So just a couple of quick photos of my own patient results. This is a lady who had a face and neck lift. 3 months is her result here. A gentleman who had the same thing, 3 months. And then a lady who had the same result. This is a 6-month result. So in all of these, you see what I consider to be a natural result where they look like themselves, just younger. So a nice little quote by Coco Chanel. Nature gives you the face you have at 20, but it's up to you to merit the face you have at 50, whether that's operated on or not. So thank you very much for your time. I've got one kind of final slide here, which is for questions, and then I'll open it up to the chat. But right now we're doing, as a result of this webinar, complimentary facelift and, sorry, complimentary facelift consult. Clarify that. Almost got killed by my marketing team. But if you do that consult, you'll get a free Fulcrum tote and a free SPF to protect your investment, or if you choose not to go the surgical route, just to protect what you have currently, your face at 50. So click here if you want to follow that link to the consult, and then I'll take questions right now. All right. Well, hopefully this was pretty informative because we only have one question, which is great. If you have other questions, I also answer those in consults. And since it's complimentary, you can come in and talk to me too. But the question in the chat is, how can patients best prepare for a facelift or any other surgery? It's a multimodal approach. So a facelift repositions the skin and the muscle, but it doesn't make the skin quality better. So the thing that you can do best is to keep your skin quality good so that when it's repositioned, it looks good too. That's the reason we usually do fat grafting and a CO2 laser with the facelift because it complements the skin quality. But if you're preparing for a facelift, doing good skincare good SPF, sun protection. Those are kind of your two best things. I'd say your third best thing is if you're smoking, quit smoking. And the last thing is if you're doing other injectables, there's a lot of discussion about what other injectables are good or bad for a facelift. It depends on the individual patient. There's been patients I've operated on who've had prior injectables and there's no trace of them. There's been patients I've operated on that have had injectables and there are traces of them. It doesn't make it any different in terms of what result I can get you, but it does make it more time consuming if those products are still present. So usually I'll say if you're going to plan to get a facelift, hold off on things that are biostimulatory that cause collagen or scar for 2 years. So that's like Sculptra or Radiesse or things that are a little inflammatory. Those things do cause collagen, but collagen can sometimes be disorganized and make my job a little harder. Any good, competent surgeon should be able to still get through that, but if it takes longer, it probably is going to cost more. Someone just asked if someone gets a ponytail lift younger, let's say mid-30s, will they need or want a regular facelift later on? And that's a great question. Uh, Depends on how you age. Whenever we do a facelift, we're saying that we're reversing the clock by a certain number of years. In a traditional facelift, it was probably 10 years. In a deep plane facelift, it's probably closer to 15, 17 years. A ponytail facelift is unique because you can only reverse it so much. You can only lift so much before you start getting wrinkles. So I would say you're reversing the clock about 8 years. So if you're 30, you get a ponytail facelift and now you look like you're 22, you're still going to age 1 year for every year. So by the time you're 50, you're probably going to look 42. Does that mean you want to get another facelift? Maybe. You look good for your age, but do you feel older than you look? Or do you look older than you feel? And so if you do, maybe you want another facelift. Doesn't prohibit it, doesn't make it so you can't get one, but it doesn't mean you'll need one at any point later in life either. I hope that answers that question. Someone asked if someone has had a prior SMAS type lift, are they still able to be a candidate for a deep plane facelift? And the answer is yes. Um, People can have multiple facelifts, and it usually gets a little bit harder every time because there's prior scar in there from the prior facelift, just like with injectables that cause collagen formation. Facelift lifts the tissue, it heals back down, and it scars too. That scar, again, is collagen, and sometimes it's disorganized, especially if you had an infection or if you had delayed healing, things like that. In most cases, just like with fillers, it's not an issue. You can lift up the plane still, you just have to be careful. And if you had a prior SMAS facelift, you never entered the deep plane anyways. So that plane is still easy to enter. It'd be harder to do a deep plane after a deep plane than a deep plane after a SMAS lift, because you're entering tissue that hasn't been disturbed versus that has been disturbed before. So I think that answers that question. Short answer is yeah, you can get a facelift after you already had one. It also changes what technique the prior surgeon did, because sometimes they use absorbable suture, sometimes they use permanent suture. If it's a permanent suture, oftentimes we'll see that and we'll have to cut it out because otherwise we can't free the layer we need to move it. All right. I've gotten through all the questions, so thank you all for being in attendance here. I appreciate you paying attention, and we'll put this online, so if you missed anything or you want to review things, you can. Um, I'll see you guys in your consult. Have a good day.